Hi students, let us continue our topic in how do organisms reproduce. So in this chapter we are at the last section now. So today we will continue the sexual reproduction in human beings. Okay, in here we are going to see today some important things. That is, let us continue with first one, menstruation. Menstruation. So what is menstruation? Okay, menstruation. This menstruation is one of the sexual act, one of the important character which we see in the female reproductive system in the process. It is actually the breakdown and removal of the inner thick, and we can say in menstruation what happens: breakdown and removal of inner thick and soft lining of uterus. Okay, so we know the shape. In the last topic we came to know about the shape of the uterus. So here the inner lining of uterus, it is mostly thick, it becomes periodically thick. Okay, so in menstruation what happens in this process: the breakdown and removal of this full lining of the uterus. This is uterus. Okay, it takes place. Not only this, along with the blood vessels which are growing there, okay, all the blood vessels, so in the form of the bleeding, that bleeding we can call it as vaginal bleeding. Okay, so we call it as now menstrual flow. Menstrual flow or menstruation. Okay, so in menstruation what happens: down the removal and breakdown of the inner wall or inner thick wall of the uterus, along with all the blood vessels which are present there, they start flowing down, they start flowing. Okay, so the cycle of this menstruation, it events, and the events of this cycle take place in the ovaries actually. Okay, the ovaries control it. Two ovaries are there, they control it, and the uterus, ovaries and uterus are involved. Okay, after every about 28 days, or we can, it is similar to 1 month, that is 30 days in the woman's. And such the flow, the rate of this flow, how many days it takes. So this is called menstrual cycle. Okay, menstrual cycle is the period in which some cyclic changes take place in the uterus and ovaries, and finally if the egg which is produced in the ovaries, if it is not fertilized, so the egg will come out through the fallopian tube and it will be pushed to this uterus. Here this egg and all the flow from that ovaries along with this uterus wall at a fixed day, that is the, we can say, first, second, third day, whatever day it is called. So at that day it all flows out as a menstrual flow. Okay, so we also call it as sexual cycle in the human female. Sexual cycle in the human female. So this flow, how many days this flow takes place, bleeding is there, it can also last about from 2 to 8 days. So it differs from different women. So it can differ from 2 to 8 days. So this was all about menstruation. What actually happens in menstruation? If the egg that is mature and it has been released from the ovaries in the fallopian tube, okay, it reaches, if the sperm does not come here to fertilize it in the fallopian tube, the egg will be diffused out. When it is coming out within a period, some days it takes, okay, so finally it leads to the breakdown and removal of the inner thick wall along with all the blood vessels in the uterus in the form of vaginal bleeding, or we call it as menstrual flow. So this process is called menstruation. Okay, the process, the flow, this menstrual flow, it lasts for 2 to 8 days, and the period, how much it renews this wall again. Okay, the wall will be formed again, then after again 28 days it will happen. So this full process is called a menstrual cycle. Okay, menstrual cycle gives us the information about the time period for the removal, for the flow and the renewal of the uterus wall. Okay, let us see something important, that is reproductive health. Reproductive health. Okay, reproductive health. Reproductive health is very interesting and very good topic for us, because we need to maintain our reproductive system. In this reproductive health, we can see all those aspects, okay, of general health, which help a person to lead a normal, safe and satisfying reproductive life. Okay, since reproduction is one of the important feature of living organisms, especially we can see in case of ours, we need to maintain this reproductive health as a normal, this safe and satisfying reproductive system. Okay, so as we see, there are some effects or there are some consequences with other systems of our body. This reproductive system is also much more affected by some issues. For example, if we call about some diseases which are only specific for the reproductive system, so such diseases collectively we call them as sexually transmitted diseases. Sexually transmitted diseases, or STDs. Sexually transmitted diseases, the diseases which are transmitted from one person to other person by the sexual act. So such diseases are called sexually transmitted diseases. So due to the sexual contact, such diseases, they can spread from an infected person to the healthy person. Such STDs, they are caused by various microorganisms. The various microorganisms are involved in it, and they are specific microorganisms. They are not the microorganisms which can infect other parts also. They are very specific to the reproductive system only, these microorganisms. Okay, so these microorganisms, they live in warm and moist environments. Their feature is that they live in warm means what? Little bit hot, and moisture environment, and such an environment is provided to such microorganisms by the sexual system, this human sexual system, like vagina, urethra, we can say. These are the places where these microorganisms can live. Urethra, anus, even at mouth also, because from mouth only they have to reach those places. So let us discuss some of the common sexually transmitted diseases, okay, which are very important to be known to us. So what are those sexually transmitted diseases? They are: number 1, gonorrhea. Gonorrhea, spelling check: Gonorrhea, gonorrhea. Okay, so this gonorrhea is caused by a bacterium. The name of the bacterium is Neisseria Gonorrhea, Neisseria Gonorrhea. Okay, gonorrhea. Neisseria Gonorrhea is the bacterium name. Neisseria Gonorrhea, it's the bacterium name, and it is this disease, gonorrhea disease, which is a disease to the private parts, that is the sexual organs. This disease is characterized by inflammation of the urogenital tract, urogenital tract means what? The tract which is associated with the urine system and the reproductive system. Okay, and the patient feels burning sensation because of this infection. What will be there? Burning sensation will be there when you go to the toilet for picturation process, that is the urination. Okay, during the urination, this bacteria infects the ureter. Mostly it will infect the ureter. We know the ureter where it is. Okay, ureter means what? It is the ureter. We can say it is mostly, we can see in the urine system, that is related to the excretory system, urine system. There we saw the ureter is one of the, and that duct, we can say it is a connection from kidneys to the we can say from kidneys to the urinary bladder. Okay, in case of man, and in case of woman, it just affects the cervix. Cervix is the path, you can see here. So this, before vagina we have a cavity here, that is called a cervix. Here you can see the cervix. This is cervix. In case of woman, the cervix is infected by this bacteria. Okay, so this was all about gonorrhea. The next one we have to see is, it is actually syphilis. Syphilis, syphilis. This syphilis It is also a bacterial disease. So the syphilis is also caused by a bacterium. The name of the bacterium is Tryptonema pallidum. Tryptonema pallidum. Okay, Tryptonema pallidum. Treponema, sorry, Trepo, T is not there. Treponema pallidum. Treponema pallidum. So how we can say that it is syphilis disease? It's syphilis disease. It is characterized by the lesions in the we can say mucous membrane. Lesions in the mucous membrane. Okay, good. So this is an infection that is associated with the urogenital tract, and there are some ulcers also. Ulcers, okay? There are some ulcers in genitalia. Genitalia means the private parts, okay? Male and female reproductive parts. So this is all about syphilis. Then we have some other disease also. One of the disease that is caused by the protozoa. That disease is called trichomoniasis. Trichomoniasis. Okay, trichomoniasis. It is caused by a protozoan. Protozoan is not a bacteria, it is other type of microbe. Okay, protozoan. The name of the protozoan is Trichomonas vaginalis. Sorry, Trichomonas vaginalis. This is also one of the threatful disease caused by this protozoan. It is mostly we can say it is characterized by there will be a vaginal discharge in the woman's. So vaginal discharge will be continuous. Vaginal discharge will be there from the urogenital tract of the females. Okay, vaginal discharge will be there, okay, in case of woman. So this was all about, these are the two bacterial diseases which we discussed here. This is one disease, that is the disease caused by a protozoan, that is also a microbe. Now we are going to discuss about one important disease that is very famous throughout the world, and we are all aware about this disease, and what it could be is nothing other than AIDS. AIDS is a disease, actually the full form is acquired immunodeficiency, acute immune deficiency disease. Acute immune deficiency and ASIS syndrome. Acute immune deficiency syndrome. This is the name of the disease. It is caused by a virus. That virus name is HIV. Okay, the virus name is HIV. Capital H, capital I, capital V. Full form will be human if immunodeficiency. Human deficiency virus. Human immunodeficiency virus. Okay. So this virus caused the disease, dreadful disease, that is AIDS. Okay. Actually, what happens? This AIDS virus, this that is HIV virus, it goes and suppresses the body's immune mechanism. So what is immune mechanism? This is the defense of the body. When there is any infection, our immune system is involved to fight with that infection. But here problem comes, the HIV virus goes and it attacks our immune system directly. It attacks our military force, so not allowing them to fight against any other disease, that is the secondary disease caused thereafter. So thus such a patient becomes susceptible. What it becomes? Susceptible to the diseases, to secondary diseases. So HIV is going and it is attacking the immune system. In immune system we have, for example, WBCs are there. These WBCs, they are attacked by the virus. This virus enters inside. When the virus enters inside, it uses the cell's system because of one process. Okay. Reverse transcription we call it as. So because of that process, what it is doing, it is inside increasing its population in the cell itself. Then finally the cell has to burst. The cell moves into pieces and it gives out lot of such viruses. These viruses go individually and they attack the new healthy WBC. Okay. So in this way, such a patient problem is there. All the WBCs, which were the military force, that it is the defense of the body, so that if any bacteria or any other microbe is coming, these WBCs, our immune cells, they used to go and kill that. But since they are itself destroyed and they are itself infected, the body is no more able to fight with the new diseases. That is, the body is susceptible to the new diseases. Susceptible means prone, so any disease can come. Now why? Because the military force is totally engaged. They don't have now ability to fight against any other disease. Okay. So this was all about this. Then let us see, how does this AIDS transmit? Transmission of AIDS. So this AIDS, how does it transmit from the infected person to the healthy person? What are the different ways? Number one is by sexual contact. With what? Infected person. Number one, sexual contact with infected person. This person is having AIDS. So whenever there is a sexual contact with such a person, the healthy person which goes in contact with such person gets infected by this AIDS disease. Then by the transfusion of blood from an infected, by blood transfusion we can say, blood transfusion. So when we transfer the blood from the infected patient to the healthy patient, so that will also get infected with the virus. Then next way can be by the use of infected needles, or we can say others. So the needles and other such utensils which have come in contact with the blood of the infected person, if such things are used reused with the healthy person. So what happens, the healthy person gets infected with AIDS. Okay, this is also the way. For example, injecting the needle and not sterilizing it and using the same needle for the healthy person, this will lead to the infection of the healthy person. Then the last one we can know is it is not only needles. For example, barber shop is there, that barber shop is using the common blade. Okay, so that barber shop is using the common blade, razor, for shaving the person. Okay, same razor he is using for what, same using razor or blade he is using for many of his customers. So sometimes what happens, there is an infected person, the bleeding will be there, so little bit of the blood comes in contact with this razor. If same razor is used for the healthy person, where the injury will be there, after that, because of that injury and this infected blood, the patient can, that person, healthy person, can also get infection. Then through the placenta from the mother to the from mother to child, at the time of what, at the time of gestation, or we call it as birth, childbirth. Okay, when the mother gets disconnected when the baby gets disconnected from the mother at the time of birth, childbirth, that time what happens, the blood of the mother gets mixed with the blood of the baby. So there are chances, if mother is infected with AIDS, the same this baby can now also get the infection of that virus. So that is the placental. At the time of when the placenta contact, we can say through placenta also, we can say it is not only during the childbirth, but throughout the placental connection of the body of the baby with the mother. So that was all about this, and now let us move to the next part of our today's session. That in the next part we are going to see what are the methods to avoid unwanted pregnancy. What are the different methods to avoid the unwanted pregnancy in case of a woman? Okay, so a number of techniques have been developed to prevent and control prevent and control the pregnancy. Number of methods have been used so far. Okay, number of methods have been used. Number of methods have been used. Number one method we can say here generally, mechanical barrier method. Mechanical barrier method. In this method, the physical devices like some physical devices are used like condom, diaphragm, and cervical caps and cervical cap. This condom, okay, it is a plastic structure, bag like structure, which does not allow the sperm to move in the in the female reproductive system. Okay, so diaphragm is also such a structure. This diaphragm and cervical cap we see in case of females, where it is used, but in case of men this condom is used. Okay, then these devices prevent their mechanical devices, they prevent they just prevent the entry of sperm into the female genital system, that is the female reproductive system, during copulation, thus acts as a barrier there. Okay, barrier means does not allow the sperms to go there in the female reproductive system. Number one. Number two is number two is chemical system. In chemical system or chemical method, the specific drugs are used. Some specific drugs are used by females, okay, which are of two types. Number one, it can be oral pill, it can be an oral pills, okay, or it can be vaginal pill. Okay, oral pill means which is used through mouth, vaginal pill means which is used through the vagina, okay, by the females. Okay, so the oral pills, these oral pills contain some of the hormones are the chemicals, biochemicals, which influence the body system, okay, at the specific points. Some specific parts of the body are influenced by these hormones. These hormones in the oral pills which are present there, they stop the ovaries from releasing the ovum in the fallopian tube. What they do? So these oral pills, they stop the entry of, they stop the ovaries from releasing the ovum. They stop the ovaries because ovaries will release the ovum, but these oral pills which contain hormones in them, they stop the ovaries to release ovum, that is the egg, into the fallopian tube, because in fallopian tube only the fertilization will take place. Okay, these pills are also called oral contraceptives, OCs, oral contraceptives. Oral contraceptives, which act by changing the hormonal balance of the body. So because we should know that all the reproductive system, that is the production of egg and other things, it is all controlled by the hormones only. When the hormone levels becomes up and down, this is having the effect, some specific hormones like progesterone and estrogen. So when there is level up and level down, it means it affects the inside process of the egg, that is the ova. Okay, by changing the hormonal balance of the body, so that the eggs are not released and fertilization is so, which stops the fertilization. Okay, finally it stops the fertilization. Then we have the use of we have some devices also for this. For example, intrauterine contraceptive devices, IUCDs, intraceptive intrauterine contraceptive device. Okay, IUCD, intrauterine contraceptive device. These prevent the implantation. What is the implantation? That is, we have already seen this when from the fallopian tube, when the fertilized the zygote formed, that zygote moves down. And it gets attached with the uterus. So this attachment of the zygote, which is in the next generation, this is cell stage, this attachment of zygote with the uterus is called implantation. But these devices are there. We use some devices. These devices, after fertilization, they are not allowing for the implantation. That is the attachment of this growing embryo to the uterus. For example, we have copper T. Okay, for example, copper T is there. Okay, copper T is available. So it is placed safely inside the uterus by a doctor or a nurse. So this copper T, it is the metal which help in the unimplantation of the zygote. Okay. Okay, good. Then there are other methods. Number 3, surgical methods. Surgical methods. Surgical means surgery, we know, cutting and joining. Here what we are doing, a small portion of vas deferens, a small portion of the vas deferens in the male is cut, and in case of female, a small portion of the fallopian tube is cut. We know that fallopian tube is the pathway for the egg ova to come from the ovary to the uterus, and vas deferens is the pathway, or it is a connection for the sperms to move from the testes to the next, that is the to form the semen. Okay, semen preparation. So before they are getting stored, they have to cross through the vas deferens. So what they are doing actually, so let it be this is, for example, seminiferous tubule is here. Okay, in this tubule, the sperm is from the from the testes, they will come and they will get stored here. But this is vas deferens. So here we make a cut and we just join it. Okay, cut and tie up it. In the fallopian tube also, we know how the fallopian, this is suppose an ovary. Okay, this is the ovary. From the ovary the egg will come. This is fallopian tube, FT. Okay, fallopian tube. So here we make a cut so that the egg will not enter here also, so that the sperm will not get stored here. So when it is done in case of the males, it is called vasectomy. What it is called? Vasectomy. Sorry, VASEC, vasectomy. Okay, vasectomy means cutting and joining of the vas deferens. Okay, in case of male. But in case of females, it is called tubectomy. TUBECTOMY, tubectomy. Okay, in case of females, where fallopian tube is cut and it is just and then joined so that the egg cannot come in the uterus. So in this case here, if we see the vast difference, in the male it is just blocked for the sperm not to be transferred, that will prevent, and if the fallopian tube in the female is blocked, the egg will also not be able to reach the uterus. Thus the fertilization in both the cases is not possible. Okay, this is the surgical method that we discussed. So this was all about the things which were concerned with the human reproductive system and human health, which we discussed. Then we have something that is sex ratio. What is sex ratio? In sex ratio, what we are going to see, sex ratio means it is the ratio of the number of females to the number of males, F by M, to the number of males in a population. Okay, how many females are there with regard to the males present in the population? The female male ratio must be maintained for the healthy society. It is very important to maintain number of females and number of males in a society. Why then this need came here? Actually, the mostly actually due to some customs, the female ratio got less in India and throughout the world. Why? Because the woman was so called as servant, and she was so called the burden to the society. That is why it needs to be maintained for a healthy society. The female child ratio, sex ratio is declining as at an alarming rate in some sections of the society because of the reckless female suicide. Okay, feticide. Okay, when they come to know that female is inside the womb, they kill it there itself. So therefore the parental sex determination has been prohibited by the governmental law. So it is not allowed to check the sex in the inside the womb. That is the prenatal means before the baby has come in the world. So to check the sex is not now allowed. It is prohibited by the law. Okay, then population size means what? So as we understand by the term itself, the organisms increase in their population with the help of reproduction. The rates of birth and death, how many births are there and how many deaths are there, that determines its size. If there are more deaths, so population will decrease. If there are more births, there is death rate is less, means population will increase. The increase in a population occurs when the birth rate is higher than the death rate. If this B is greater than D, so what will happen? Population will be higher up. But if B is less than D, population will decline down. So this is the way how we calculate the population size and come to know. So my dear students, now we have finished our topic. There are many questions which I have to ask here to you people. So let me not write the question so that I can know how many students are watching this video. So my question to you people is, name the organs which produce male and female germ cell. Okay, name the organ which produces male and female germ cell. Number one question, what is the name given to the fusion of sperm and egg? When sperm and egg is fused, what is that name given to this? Okay, next question is, where does this process, fusion of male sperm and egg, take place in the human females? Which place of the human, that is female reproductive tract? Then next question is, what happens to the egg if it is fertilized? Okay, if the egg is fertilized, what will happen next to it? Then the last question is, what happens to the egg if it is not fertilized? What happens to the egg if it is not fertilized? I will repeat my questions. Name the organs which produce human germ cells, that is male and female cell. What is the name given to the fusion of sperm and ovum? Where does it take place in the female reproductive system? What happens to the eggs if it is fertilized? And what happens to the egg if it is not fertilized? So these are some few questions which I asked, and you have to send me the answer in the group, okay, when it will be asked to you. So till we move to our next class, thank you and goodbye. I encourage all the students to follow our next sessions.